So as you know, we've discussed, I've had horrible acid reflux issues, which have kind of caused to the erosion of my enamel on my teeth.
You're going down to Costa Rica to get this done because it's supposed to save you money.
It goes right here, is then there.
I myself need $10,000 worth of dental work done right now. And I never have once considered going anywhere else other than in the United States to do it.
What kind of a support system are you going to have down there?
There are hospitals that are fully credentialed.
Third world, United States.
I think most everyone agrees that the healthcare system in this country is broken. I think there's going to have to be some kind of disruptively innovative change. No one knows where that's going to come from.
There's a lot of hype about medical tourism, and it does have a lot of potential.
You're going to see the creation of global brands in healthcare.
Somebody needs a hip replacement. It might cost anywhere from $60,000 to $90,000 in the U.S., and we can do it somewhere in the world for maybe $8,000, maybe $15,000, depending on the location.
All the things that are happening in the U.S., they're really not going to solve the healthcare cost or quality problem.
It's got the potential to be huge.
In the U.S., you know, dentists, they've got their 5 techs around you and they do their job, and they come in and spend their 10 minutes with you and tell you what they think you need to hear to, you know, collect their paycheck, and then they leave.
Whenever somebody first comes to Taiwan, they really have no idea, and they're scared about the quality, but it's actually really good, and the hospitals are all brand new and they have the most advanced technology.
Many of these hospitals have designed themselves for the international traveler.
Sometimes a doctor will go and visit the patient at the hotel or the recovery retreat. You know, you don't really get that here in the States. You don't have any doctors, at least nowadays, making house calls.
1,800. Okay. Mm-hmm.
The cost is important. Obviously, that's why they're leaving the U.S. to have this work done.
How much is it going to cost you to have it done in Costa Rica?
About $8,000.
How much would these procedures have cost you if you had it done them over a period of time under a controlled environment in the United States?
Approximately $25,000.
She's definitely going to have, you know, a lot of work done. Extractions, bone grafting, dental implant, 4 root canals, 4 crowns, and then a deep cleaning.
Sitting in a dental chair for 4 hours, and then for 8 hours, and then for another 4 hours the next day. It takes some strong resolve.
They're by themselves, they're in a foreign country, they're undergoing a cosmetic or, you know, a necessary medical procedure, and that, you know, can add a lot of anxiety and emotional stress.
How am I going to open my mouth for her to do the root canal in the front if I can only open my mouth, you know? That hurts right there. Yeah.
I'm concerned about what you're going into. It's not minor stuff. It's major dental surgery.
There's a 50% chance that I might be
Paralyzed.
Today I had the bone graft, I had the implant, I had the 2 wisdom teeth also that were impacted in my bone. It's just too much.
The future is going to involve consumer choice due to lots and lots more data.
The dentists in the States that use that type of equipment and that have that level of expertise are not at all affordable to anybody in the middle class.
In my city, Boston, and looking at, you know, 2 or 3 different hospitals to go to, they're all probably within a few miles of one another. If you were looking at a medical tourism trip, you may be looking literally all over the world.
I would say like 70% of my patients are Americans.
I think it's a fad. People are going to start having complications from the procedures. They're going to start dying or be really maimed.
There are good and bad doctors in every country, just like there are here in the U.S.
And their vacation is going to turn into a horror trip.
The people that make the strongest case for that are people that have never been there.
I have really no idea other than what I've researched online what to expect.
It's the fear of the unknown. Everybody is going to go through it.